We are now with this patient of lupus. How many years did you have lupus?
5 years.
5 years. How many doctor did you see for your lupus?
I seen one.
One
And-
only.
Yes.
He has, you visit him only 5 years. Okay?
Yes.
How many months do you have coming here?
I've been coming with you guys for 3 months, 4 months. This is
4
my
months.
fourth month. Yes.
And what happened with your treatment with the doctor, the rheumatologist in California?
Since the 4 months I've been coming here with the treatment, I started the day after. I stopped taking all my medications my rheumatologist would give me. I just went back for my 3-month checkup, blood work. He does 3 indicators for the lupus, and all 3 of them came back negative. He couldn't believe it himself. He was just like, I don't know what you're doing. Keep doing what you're doing. He goes, but you're really well. And it's only been, this is my 4th month, starting my 4th month here.
Thank you for your video, because you are going to help thousands of patients with lupus that the doctor, the thousands of doctors say lupus no cure. Here, in 4 months, 3 months, how many months?
4? Starting
4
4
months.
months.
This is the 4 months?
Yes.
Okay, 3 months.
months.
3
Yeah.
months of treatment. How better do you feel?
Like in almost 90% better. Pretty much just have a pain here and there, but overall, no more chest pains. I had for 2 years, 2 to 1 years, we were in and out of the hospital, just pains, chest pains. They couldn't figure out what it is. I would go, they'll give me this strong medication. I would be there for a night and then go home, just back and forth from hospital to hospital. And now how I said, chest pains, they went away. I've been feeling good, normal life. Doctor was saying that lupus doesn't go away. It's just, it won't go, there's no cure for it here. It's a bacteria that we have. And just with antibiotics, you could cure it. And I've seen the results. Even my doctor, my rheumatologist, he hasn't put me on remission yet, but I'm guessing he wants to do the blood work one more time until he can finally say it's on remission, which they say they put it to sleep. But here it's gone, they take it away. It's just the bacteria.
What he say when he see the fire?
He couldn't believe it. He just kept switching his pages, going back, reading results from years back, from the last time I went 3 months ago, and he just couldn't believe it. And then me and my boyfriend were just looking at each other like, what's going on? Am I getting worse? And then he finally comes out saying like, oh, you're doing really well. He goes, your test came back negative. He goes, just keep doing what you're doing, and I'll see you back in 3 months to do routine blood work.
What kind of medication do they give it to you?
I was drinking Plaquenil and steroids. He wanted to start me a methotrexate, but I didn't want to. I refused to. And he was really upset, saying like, I'm the doctor, but at the end of the day, you take your final decision. I can't force you to take whatever you want, but I knew that medicine's to treat cancer. I don't have cancer. Why would I be taking that? And how I said I refused to take it until thank God I came here, Tijuana, in Hospital Mexico, and it's been awesome.
What kind of medication Dr. Mora is giving to you?
I'm just taking basic antibiotics. That's all it is. Antibiotics.
Okay, we are thinking that the lupus is bacteria.
Yes.
Is producing an infection in all your body.
Yes.
And that's why it's all the symptoms that you
Yes.
feel.
Yes.
It's not true that it's autoimmune. Your
No.
body is not going to hit you yourself.
Yeah.
It's an infection. We prescribe medication, antibiotics only. The bacteria is gone. You don't feel nothing. If it's autoimmune, we kill the bacteria and you continue having the problem. You are almost 90% better.
Yes.
Okay? I'm telling everybody that has lupus, if they want to be cured, if are far from here, they can ask the doctor, her doctor or his doctor to prescribe antibiotics. We do here a lot of tests for bacteria, and we do the dark field, we do the smear of blood, and we find a lot of infections. we check more infection too in the body, in the blood. But if somebody has lupus, you must come here or tell the doctor, your doctor, to call us, and we are going to tell him what he can do for cure the patient with lupus. No prescribe these venoms that kill the patient. Kill the patient. The patient can be very bad with the medication. It's very bad. Okay, you feel very bad when you was taking this medication?
I see no difference. I was just the same. Nothing. It was supposed to make me feel better. It wasn't making me feel better. How I said I was kind of getting worse over time. I was just getting more pains and aches, and that's why he wanted to give me a stronger medication, which was for cancer, and I refused to take it. 'Cause I don't have cancer. Why should I be taking it?
As soon as you start taking the medication of Dr. Mora,
Yes.
how do you feel?
Within the 1 month, I seen the difference. Yeah.
Okay, thank you for your video. It's going to help thousands of patients with lupus.
No,
What
thank
do you
you,
think,
guys.
my friend?
If you have any doubts, take it from her. Lupus, 5 years, going on 5 years, and now a 90% better.
I had my doubts coming myself too, because
Yes.
people say antibiotics are bad. You're not supposed to take it more than 15 days. I myself didn't want to come. I came, but I was like, I'm gonna get worse. This is not gonna help me. I came so negative. I was upset. I didn't want to come. And look at me now. I'm 90% better.
Yeah. The worst mistake you can do is by not trying to look for answers.
Yeah.
Okay, thank you for your video. It's going to help thousands of patients with lupus.
Thank
Thank
you.
you.
No,
Thank
thank
you.
you
For your
Thank
patient, yeah.